Okay, I have it at noon, so welcome to everyone. We're going to go ahead and get started with the webinar today. Welcome to the Nutrition and Aging Resource Center's webinar, Navigating Partnerships Between State Units on Aging and Universities. We are excited to welcome Alexandra Bauman and Dr. Sarah Francis today. Alexandra Bauman is the Navigation and Supportive Services Director at the Iowa Department of Health and Human Services, Division of Aging and Disability Services. She wears multiple hats and serves as the Director of the National Resource Center on Nutrition and Aging. She is a registered dietitian and she manages the Older Americans Act programs and services for the state of Iowa, including nutrition, navigation, Aging and Disability Resource Center, and transition services. Dr. Sarah Francis is a healthy aging advocate, implementation scientist, and registered dietitian. Presently, she is a professor in food science and human nutrition at Iowa State University and is serving as the research director at the National Resource Center on Nutrition and Aging. With a rich experience spanning 20 years in community health and aging, Dr. Francis dedicates her efforts to developing and evaluating theory-based nutrition and health education programs. Her work, deeply rooted in social marketing theory principles, targets older adults and underserved populations. Through her extension programming and research endeavors, she aims to engage, excite, and empower adults to prioritize their health, one behavior change at a time. During today's session, Dr. Francis and Alex Bauman will demonstrate what can happen when a collaborative partnership is mutually beneficial. Before we get started, I want to mention some housekeeping items. First, we will hold questions until the end of the presentation. Our team will be monitoring the chat and Q&A throughout the session. Please write any questions you may have there. We will start the QA session with the chat questions first. You can also raise your hand using the icon and ask your question orally. At the end of the Q&A session, we encourage everyone to complete the evaluation that is accessible with a QR code or the link that will be placed in the chat. The information you provide will help us during our next webinar. The Nutrition and Aging Center is continuously working to improve the accessibility of events and content. Automated closed captioning will be provided for this webinar. Participants can enable captions by selecting the CC in the toolbar or closed caption in meeting options. This webinar will also be recorded and made available on YouTube. The video with captions revised for precision will be shared via the Resource Center's newsletter. If you have any questions about captions or additional accommodation requests, please email nrcna@hhs.iowa.gov. Finally, we did not seek a prior approval for this event for CPEU credits for dietitians. You can still receive credit under the CPE Activity Type 171, teleseminars, and webinars. Please visit the CDR website for further instruction. And now I'm going to turn it over to our presenters.
Hi, Alex and I are so excited to be able to spend an hour with you today to talk about our partnership. The objectives for this session is to increase awareness of how the Aging Network and Extension can collaborate, help you gain ideas about specific nutrition, aging, and research projects to replicate in your own communities, and to help you gather resources that support your work in the Aging Network or Extension.
Thanks, Sarah. So I know I see several people listing where they're from in the chat. Thank you. It's very nice to see you here today. There seems to be a good mix of people from the senior nutrition program or from universities or extension. So we're going to start with a little bit of background about each of those for those that aren't familiar with the other. So the senior nutrition program, what is it? The Older Americans Act is a federal law that provides programs and services to older adults and their caregivers. Federal funding is passed through state agencies called state units on aging that also pass through funding to area agencies on aging to either provide services directly or contract with providers to provide those home and community-based services to older adults and their caregivers. The Older Americans Act Senior Nutrition Program is a little bit more what we're focused on today, and that includes congregate meals, like meals provided in senior centers or in other community buildings and even in restaurants, home delivered meals, nutrition education, and nutrition counseling. The Older Americans Act Senior Nutrition Program is located in every state and U.S. territory.
For more than a century, cooperative extension, in conjunction with the land-grant college and university system, has quietly played a vital role in helping to address rural and agricultural challenges that help to foster the vitality of rural America. This invaluable institution is rooted in the three pillars of the land-grant mission, which are teaching, research, and extension. The U.S. land-grant college and university system was originally conceived to make higher education accessible to the working class, with a strong emphasis on applied sciences such as food and nutrition, family studies, agriculture, and community economic development. Cooperative Extension's unwavering commitment to serving Americans, especially those in our rural areas, has withstood the test of time, surviving the challenges of the Great Depression, the two world wars, the farm crisis, and most recently, the global pandemic. Throughout these trials, Cooperative Extension has remained steadfast in bringing practical research directly to the people, enabling them to make choices that help improve the health and well-being of their families, gain access to essential services that help them thrive, access to professional development opportunities, and enhance farm productivity. As Alex and I were preparing this presentation today, we both thought it would be good to share how we got into the aging spectrum, because neither of us had that on our career pathway. So I'm a registered dietitian by training, and when I was an undergraduate student, I was very ageist. There was no way I was going to work with an aging population because older adults are resistant to change. I was quickly corrected when I started my first job as an inpatient cardiac rehab dietitian. And in my experience, some of the most motivated clients that I interacted with were those who were older. They were either retired or had grandchildren, and they wanted to make sure that they remained active and healthy so that they could enjoy their retirement to their fullest and play with their students. And that's the grandchildren. And that's what led me to the career path that I'm on, is just that very positive experience that I had. And so for the last 20 years, the audience that I've worked primarily with are older adults.
Yeah, similar to Sarah, I am also a registered dietitian. I wanted to know that I was going to be a dietitian from a young age in high school. I was really interested in food and nutrition, and I created a lot of recipes. I was a student athlete, so I kind of liked the athletics field, and I also liked the creative field, like creating recipes and working with magazines and things. So I assumed that I was going to work somewhere in those kinds of fields, and working with older adults was not on my radar at all. However, once I became a dietitian, I started working for a region of nursing homes and behavioral health homes in rural Illinois. And I will say it wasn't my favorite job, but it dipped my toes into working with older adults. And I'll say that because I really loved the people I was working with. I did. I loved the facilities. I loved what I was doing. However, as I mentioned, I was a creative person, and I felt stuck a little bit when I was working with my clients. Most that I talked to didn't want to live in the nursing home. They wanted to return home and in their community. So when a job opened at the State Unit on Aging in Iowa, I was really intrigued because it allowed for a little bit more creativity in working with policies and creating programs and providing education to people, but helping older adults stay in their homes and communities. So ever since then, I've fell in love with working with the senior nutrition program. We travel to a lot of conferences around the country, and I get to meet with a lot of people here in the state of Iowa. And what I found is the people I work with and the people in this field are all extremely passionate about what they do. Um, I think for those on the call today, you probably agree with me. I haven't really met a field that's so caring and passionate about working with other people. So that's just inspiring on a daily basis. I was not working here it was previously the Iowa Department on Aging. My predecessor was the one who first met Sarah. However, what they told me is when they had that initial meeting, the first thing that kind of stood out to them was a sharing of their vision and mission statement. So I'm going to share our vision and mission statements of the Iowa Department of Health and Human Services and Iowa State University on the screen. And you can see how they relate to each other and how they're really similar missions and visions in helping people. The mission of Iowa HHS is to provide high quality programs and services that protect and improve the health and resiliency of individuals, families, and communities. And we're a trusted leader and partner in protecting health and providing high quality, equitable services.
Iowa State University Extension and Outreach's mission is to build a strong Iowa by engaging all Iowans in research, education, and extension experiences to address current and emerging real life challenges. The vision is that extension and outreach will advance land grant values by engaging all Iowans in solving today's problems and preparing for a thriving future.
So there's a lot of like resiliency and thriving and health and communities kind of woven into both of these statements. As you're looking at your own vision and mission statement and your agency, I think it would be interesting to take a look at your counterpart if you're a area agency on aging or state unit on aging or a land grant university. Take a look at yours and then also take a look at the others in your state. So we are in the process of a survey to examine how the senior nutrition program and extension are working collaboratively. Went out a few weeks ago and we're getting some responses back in real time. So we wanted to pull some current data. Based on the data that we received and the responses, many respondents have shared that they are partnering with each other. So that's good. I don't know if who's on the call today, if you're already partnering with your extension or your senior nutrition program. But what I've also noticed from there is there are quite a few people that are unsure too, and that's okay as well. Hopefully this webinar is helping to clarify a little bit about the roles of each of the organizations. So with that, can you please share in the chat for everyone? We want to know if you work in the Aging Network, what ways do you currently partner with a university or cooperative extension? So for those that said, yes, I do, can you share a little bit about maybe a project that you do or ways you meet together? And then all similarly, if you work for a university or cooperative extension, in what ways do you currently partner with the Aging Network? So thank you, Cherie. Say nutrition education, evidence-based program. I believe that's Walk with Ease.
We have another
Oh,
Walk with These too from Oregon. Yeah.
we have partnered with a local college that provides a regular group of volunteers. We also have Master of Social Work students that shadow our Meals on Wheels routes and have spoken in university classes about our work. That's great. Another Walk with
Yeah, and in Minnesota, it looks like they're doing a lot of experiential learning experiences and internship opportunities. Lots of nutrition education through extension. This is exciting. This is like filling my bucket. So thank
Yeah.
you. Lots of different ways that people are connecting.
And these are great ideas because we'll be talking a little bit more about what we've specifically done, but it doesn't capture what's happening nationwide. So it's always interesting to see how others have found connection in their work.
So as Alex said, we are in the process of surveying each agency personnel on how they're partnering. And the current survey asked each agency's like what the other offered them as part of a partnership. So from the senior nutrition program perspective, one of the key things the partnership offered them was education and outreach services, which is highlighted at the senior nutrition program is that dark blue line in this table, in this figure. And then extension responses really focused on the access to a key audience, which is that older adult audience that they're trying to serve. And so extension responses are that light blue or teal blue, and they're really about like the location, access to aging audiences, the networking piece. Whereas, like I said, senior nutrition program perspective is really the educational resources and programming. So in the chat, I'd like you to share barriers or challenges that you have encountered when working with either the Aging Network, if you're extension, or a university or extension, if you're in the Aging Network. Lack of response or interest from the local universities. Oh, there we go. Some more. I was just like, wow, that's the only challenge. Helping with community connectors, having different goals. Yep. And that's why it was so important when we were talking about the alignment of vision and mission. Need to just reach out and introduce consistency of leadership. Mm-hmm. All right.
Okay. So, as I mentioned with that ongoing survey, if you'd like to share feedback with us about your senior nutrition program and extension partnership experiences, you can go ahead and take your smartphone and scan the QR code link here. And that way you can provide more feedback to this ongoing research. That would be really helpful. But what we're seeing about as the top three challenges for current responses are bureaucracy, limited time and capacity, and staff turnover. So what we've really seen is the key to maintaining consistent communication between both entities to determine where collaborations make sense and can share resources, particularly when it comes to human capital.
So we also asked the senior nutrition program extension specialist to select the attributes that best describe their current partnerships with one another. And as you can see in this table, both said they were collaborative, they were balanced, and they were informative. And really, I think this is how Alex and I would describe the partnership that we have between our two agencies as well. We are extremely collaborative, as the next few slides will demonstrate. We're balanced in the workload for each agency, really making sure that everyone benefits from it. And we maintain that constant communication so that each agency is informed of the activities that the other is doing. So this flow chart demonstrates the different ways in which Iowa State University Extension and the Iowa State Unit on Aging have worked collaboratively over the past 15 years. And we've done so on a variety of projects, ranging from needs assessments to nutrition and health intervention pilots and meal site-based research. The projects demonstrated here have helped both agencies have a better understanding of the needs and preferences of older Iowans in terms of their nutrition needs, their nutrition preferences, their health and well-being, as well as the best way in which they want to receive nutrition and health information or hear about new and upcoming interventions, and also ways that they would prefer we try to engage them in the congregate nutrition program. And our efforts over these past 15 years have reached more than 10,000 Iowans. For those who have academic appointments, we've have 15 journal articles that have been published in peer-reviewed journals. We have trained numerous nutrition students, which helps increase the number of trained healthcare professionals in the area of aging. And we've secured over $6 million in grant funding to support our work. So, okay. Stay Independent is an example of taking needs assessments that purpose was entirely not program development. It was really to help us understand what the needs were of older Iowans. And I was able to take that needs assessment data that was collected through various projects that the Iowa Department on Aging Extension worked on jointly to develop a new program called Stay Independent. And the Stay Independent courses were designed to focus on the nutritional and physical activity risk factors that were increasing the nutritional risk of older Iowans. The target audience is adults age 60 and older who are community residing. So these are adults. Alex, if you want to click, I kind of moved down. They're the older adults who are living on their own or with an adult children, living in a senior apartment, retirement community. And we do have those who reside, who are younger than 60. Sometimes adult children will bring their parent to the session, and really the information that we have helps support healthy aging at any age. And so we really welcome everyone, although our efforts are targeted for that 60 plus. And the objective for each of our sessions is to increase participant familiarity with the topic that is being discussed and their likelihood of making recommended changes. We currently have 6 nutrition and wellness lessons, and we also have 4 financial and general aging sessions. And the reason we Stay Independent initially started as a food and health, nutrition and wellness program, but as we all know, aging is very interdisciplinary. There's many factors that play into how well someone is able to age healthfully. And so we move towards making that and truly interdisciplinary program. And actually the 4 financial and general aging sessions emerged after some focus groups that we were doing as part of an innovation in nutrition grant through the Administration of Community Living. And these topics that we weren't even anticipating, like how do you plan for retirement, how do you plan for your funeral, emerged as topics of interest to congregate meal site participants. And so Extension took this information and responded to that. A key partner for our program delivery of Stay Independent are our local congregate meal sites. In fact, we developed short pre-recorded sessions that highlight key points from each of the Stay Independent comprehensive sessions with discussion guides so that our county-based extension partners can facilitate sessions, Stay Independent sessions during the 20-30 minute lunch hour. And this was done based on some of the focus groups that we conducted that found that lunch and learns were a draw for older adults to consider going to a meal site. And so lunch and learns are also a great avenue for extension to partner with our local congregate meal program providers to fulfill our mission as well. And so it's been a really nice partnership in this regard. And this program reaches it's reached over 1,100 Iowans since it started in 2017. Another example of a project that we are collaborating on is the nutrition education. So for the Older Americans Act, nutrition education is required. Monthly nutrition education is required. And so the Words on Wellness newsletter was created by ISU Extension in 2011. And the intent was to provide standardized research-based nutrition information across the state rather than 11 or 12 different newsletters that were being written individually by our food and health educators across the state. And so the statewide newsletter talks about like nutrition, physical activity, food safety, food security, and general health and well-being. And an evaluation of 2015 has actually shown that the readers who are receiving the WOW newsletter are using that to make informed food decisions based on the information that they're provided. And so we had been doing this for years. It's been a really well-received resource through Extension. And during some general conversations with Alex, I became aware that each area agency on aging, and I believe there's 6 in Iowa, were using a different method for meeting the nutrition education requirement through the OAA. And so in 2019, Alex and I worked together and with the area agencies on aging, and we are now providing the WOW newsletter as the monthly nutrition resource for the congregate and home delivered nutrition program to all area agencies on aging. And so now there's a few exceptions are using the WOW. And so this also was mutually beneficial to Extension because we were able to expand our reach. There's also a Spanish language version that we started 2 years ago. And this also allows the area agencies on aging to reach those Spanish speaking customers that they're serving. And we also, with the Nutrition Aging Resource Center website, we've provided the link to the WOW and Su Salud Primero, which is the Spanish language version of the newsletter. And then 2 years ago, Alex, I'm on the next slide.
I did want to talk.
Oh, yeah.
Too. I was going to mention the Older Americans Act requires nutrition education, but what that looks like and what the specific requirements of frequency are then determined individually at the state level. So monthly is the state requirement in the state of Iowa, but in your state that could look different.
Thank you for that clarification, Alex. So WOW we had been working really well with WOW. And then 2 years ago, we learned that some area agencies on aging were taking the WOW newsletter and creating complementary PowerPoints that supported the WOW. And simultaneously, in Extension, we were deciding to expand the scope of WOW. And so during our revising of WOW, we decided to make it a multidimensional program. It has remained a 2-page newsletter with it now has an accompanying PowerPoint presentation that highlights the key messages of each article. I'm kind of like it's the infomercial of the newsletter. It provides an optional recipe tasting and a discussion guide for non-PowerPoint delivery. So you can use a PowerPoint or you can just have the discussion. And the facilitated discussion and PowerPoint presentation is able to be delivered through our extension partners in every county or the meal site managers or other team members. So we were able to take this indirect outreach tool and make it an interactive direct education opportunity for the congregate nutrition sites to use.
So this started, back in 2017. Iowa had a decline in congregate meal participation statewide. It had declined by about 45%, which is not great. It was a national trend, but we were near the top of the highest decline in congregate meal participation. So, there was a grant opportunity that ACL put out in 2017. They're called Innovations in Nutrition Grants. That was the first time they had put that out, but they've continued to release them annually since then. And we were awarded the grant to help innovate the congregate meal program in partnership with one of our area agencies on aging and with Sarah and her team. So what we did was we created a innovative congregate meal program called the Encore Cafe. The Heritage Area Agency on Aging created this program in 2017 when they typically received about 39 participants in their counties throughout the course of the grant. That reached over 1,200 participants in just 2 years. So it was wildly successful. And Sarah's team worked on the research and focus groups behind this. They talked to different participants and non-participants about what they'd like to see and what would help others come to the congregate meal program. And it was very successful, as you can see by the numbers. The Encore Cafe resulted in increases of 386% in meal distribution and over 3,000% in the number of participants during that 2-year period, compared to a 20% reduction at traditional meal sites across the state during that time.
And from the extension perspective, on paper, this looked like, well, this is a meal site intervention. What's the role of extension? We're education. But as I was saying earlier, a lot of times we are doing these focus groups and needs assessment with a different purpose in mind. But the information collected, we are able to use an extension to figure out, okay, this is what's driving them to a meal site. It might be also driving them to education opportunities. So how can we start really ensuring that our outreach efforts and messaging are client-centered? And from an extension perspective related to the Encore Cafe collaboration is it provided graduate student research experiences, experiential learning opportunities for undergraduate students, and it provided us a better understanding of what motivates an older adult to attend programming and what type of topics that they want. And we've used that information in extension at Iowa State to modify our outreach and promotional efforts.
And that brings us to a little bit present state, but really 2021. There was another grant opportunity that came up with the Administration for Community Living for the Nutrition and Aging Resource Center, what we have now. So when I saw it come across my desk, it was asking for an organization to create resources to help the Senior Nutrition Program Network innovate, have better business practices, and educate. And I thought, well, that's exactly what we do here at the State Unit on Aging. We help our Iowa AAAs, and that's exactly what we've done as a partnership the last several years between Extension and the Department on Aging. And so I just called up Sarah and said, hey, this is the opportunity. Would you be interested in partnering? And Thank goodness for you, Sarah, because you're just like, yeah, let's do it. And we wrote up an application in about 3 weeks, and we built really an amazing team and have seen some amazing growth the last couple of years. But I can't talk about all the things we do with the Nutrition and Aging Resource Center today, but I'll mention a few that have been really instrumental in our partnership together. First, we created an entirely online training course called ICAN, the Instructional Campus on Aging Nutrition. And that's been an interesting partnership between us because it's hosted on a university is it campus or campus platform.
Canvas.
With all of the Iowa State University tech support and videography. And then the expertise for the content behind it comes from the dietitians at the State Unit on Aging. So that's one example. This summer webinar series is another example. We've been doing these since 2022. Based on, we do the Iowa State team completes all the evaluation for the Nutrition and Aging Resource Center and doing annual needs assessments and satisfaction surveys. So we take a really research-based approach to the content we put out. We see what the needs are, what people, the best formats people want to consume education in. We put on an annual meeting, conference of sorts for grantees of ACL, and that's done by Iowa State Conference Planning and Management, and then collaboratively between the State Unit on Aging and the Iowa State Extension team members. And we've also identified subject matter experts throughout Iowa State University, and not just the nutrition subject matter experts. There have been subject matter experts from the business college, talking about AI, talking about marketing, talking about gerontology. So the wealth of knowledge the university brings with the diversity has been really synergistic with the needs of the senior nutrition program. And we've been able, as the State Unit on Aging, to really leverage all of that great knowledge and resources to share nationwide.
And Alex, I want to add a couple things. So with Extension, there's a movement towards policy systems and environment work. And this is one way that Extension is being able to help positively support policy changes, because the policies, procedures, processes for the Older Americans Act are often shared on this website. And so knowing how we can use a research base to inform how we communicate those messaging is really important, and it helps meet the mission of Extension. The other one aspect of the Nutrition Aging Resource Center that was exciting for me when we were working on that grant application in 3 weeks was envisioning the resource center expanding. And so currently the target audience are those working within the senior nutrition program, but we envision it being able to expand out to healthcare providers, as well as better connecting the resource center, state units on aging, and extension together. So we can have a resource where physicians, extension educators can go to understand the special needs of older adults, or see how they can connect within their own states to help support the healthy aging of their older residents. So Alex and I probably could have spent at least 3 hours talking about our partnership and what we've been able to accomplished through those, but we saw one of the barriers was limited time, and so we only had 45 minutes to do that. And I really credit the partnership that I have been able to establish with the Department on Aging early on in my career in Iowa State. They were the ones that were able to help me support my where I wanted to my research and extension programming to go. And if it had not been for them, I don't think I would have been as successful on that, because it was their partnerships that really made those grant applications and those projects successful. The first step that we did was I met with at the time, the director of SNAP Ed for older adults at the Department of Public Health and the director of nutrition for the Division on Aging. And we met over coffee. None of us had an agenda. It was not a transactional meeting. It was really, let's have coffee and have a conversation about what we wanted for older Iowans. And these conversations actually helped us stumble upon project ideas that would be mutually beneficial to all the agencies. And so once we had this conversation, we were able to determine some project ideas. And so the agencies, we all explored different funding opportunities, sharing them with one another and saying like, hey, how about we try it, send out an application for this. And our collaborative efforts have been supported by private foundations, the National Institute of Food and Agriculture, the Administration on Community Living, ISU Extension and Outreach, as well as SNAP Ed. And it really just started over a conversation about what we saw for the future for older Iowans. And from there, we were able to leverage our resources from each other in each agency to achieve those goals.
Yes, it really is simple networking. When my predecessor left in 2018 and I was onboarded, the partnership between our agencies could have really easily just dropped, but Sarah thankfully reached out and said, "Hey, you're new here. Let's have a conversation." And then it went from there. And we haven't always been partnering on something like every month. There's not always a project throughout the years. We listed about 3 or 4 that we've continued. But what has always stayed consistent is at least like a touch base at some point of the year. At times, maybe that was once a year. And now, as we're in a project, it's more like once a month. But it's just that touch base to continue to see what are your current priorities that each are working on. We actually did this recently a few months ago when we touched base again and just I know we're working every month on the resource center, but what else is going on in extension and what else is going on at the Iowa Department of Health and Human Services so we can see how we can connect further. Or I've also gotten really great connections from Sarah too. Maybe a project wouldn't work with her, but she has another colleague that would be interested, and vice versa. So, and we're both dietitians. So, of course, anything centered around food usually helps and leads to a positive experience. So, as Sarah mentioned, a cup of coffee or lunch or something, that's just good networking. So, if you're wondering specifically, this is so exciting. How do I get connected to the Aging Network? Or how do I get connected to Cooperative Extension? So it says there are state units on aging, but I should really say state units on aging and area agencies on aging, which are the more local providers as well, because ACL has several grantees that we work with that have really strong partnerships between the university and the area agency working on different research and innovation projects. But check out the Elder Care Locator. The link is located on the screen, https://eldercare.acl.gov. If you type in your zip code or location, it pops up the state units on aging or the area agencies on aging in that area so that you can find their contact to reach out. And you might not, the first person you contact with might not be maybe in the nutrition realm, maybe it's someone else, but if you know what to ask for, like, hey, I'm looking to find a contact at your agency that has XYZ kind of background or knowledge, that would be a great first place to start.
And from the extension point of view, I've listed 4 resources or locations where you can start getting some more information. So the Extension Foundation shares with you the different work and programs that are being offered nationally through Extension. learning more about the impacts that extension can have, in a list of your local land grant institutions is that land grant impacts link. NIFA aging extension programs. A few years ago, there was a survey completed of all aging related programs that are being offered through extension. And so that is a list. Now, I will say I was recently contacted because one of the programs that was developed in collaboration with the Iowa Department on Aging was listed, and we retired that program. But so just keep in mind, like some of those programs, because the assessment was done several years ago, may not be offered, but at least it gets you connected with someone who may be able to connect you with some other aging resources. And then for those in the Midwest area, we have the North Central Region Aging Network. This is an extension group focused entirely on aging. And again, they have some resources of aging related programming that may be offered in your state or community.
So, call to action. If you take one thing away from today, I just encourage each of you to reach out to your respective organizations. And so that's it. That's just a really simple call to action. Make that connection, make that personal contact. Use the resources we provided to find who that contact is and ask if they want to get a cup of coffee or tea if you're a tea drinker.
So I think we're open for questions. And so Shelley and team, I have not been moderating the chat, so I don't even know if questions have popped in.
Yeah, we don't have any questions that are in the Q&A. So if anybody wants to raise their hand or put it in the
So I see that there's a question like, is there a link to the ICANN course? And Savannah may have put that there. It's on their website. And honestly, it's a wonderful resource for extension as well. There's a lot there about recruiting people, volunteer management, and just general information about what the Resource Center is and the Older Americans Act. And best of all, it's free.
Yes.
Okay.
Yes. Oh yeah, go ahead.
Sorry, we do have a question that came up. How does funding work?
Carefully.
So,
no.
From a baseline level, when I mentioned the Older Americans Act, that's a series of funding that goes out through state units on aging and area agencies on aging to provide meals and nutrition education. So there's federal and state funding for older adults and community programs. Now, it's not, I would say relatively, it's not like a very large amount of funding like a state Medicaid program, but it is a pot of funding designed to help older adults age in place. So the funding goes to nutrition counseling, nutrition education, congregate meals, and home delivered meals. I'll let Sarah also talk about her funding a little bit more, but some of the specific projects that we talked about too, we also applied together for grants. So like additional discretionary grants to do those projects.
Yeah, and I'm making the assumption that that was probably where the question was. So with the grant proposals that we do, with the Resource Center, the Iowa Department of Health and Human Services is the primary award winner, and Iowa State Extension is a sub-awardee. And so in other projects, Iowa State was the primary, and then we worked, to support the programming elsewhere with sub-awardees. So we've had to work through each agency's granting agencies for memorandums of understanding, work, scope of work plans, and then our agencies, the money, Alex and I, we look at the budget, we handle the budget, but all the financial transactions are handled through our budget offices at each institution. But this is where it's so important to have those conversations early on, in figuring out like how to work, because it needs to be mutually beneficial. And so just talk to your university. If you're wondering how something like this would work, just reach out to them and they'll be able to your research office or your funding office would be able to help you with that.
Okay, Sarah, so I'm just going to extend the question from the same person, which I think you may have answered already. How does funding work to fund the nutrition education if the university is providing it for Title III meal sites?
I see. Okay. So Sarah can provide more details about how they fund the creation of the newsletter. But essentially, so we receive the newsletter from Iowa State Extension as a PDF document that we send along to our area agencies, and they use their own Title III funding to print those documents and share them at the meal site. If you'd like to expand more about the actual creation of the WOW newsletter, Sarah.
Well, the WOW newsletter, extension agencies are state-supported entities and federally supported entities. And so we have federal and state tax dollars that support our work. And so that is what is used to fund, more salaries, right? And so it's an online, it's an e-newsletter. And so there's really no production cost. It's the time of our extension educators who are writing the articles. If the question was about like getting reimbursed through the Title III funds, no. Extension, we consider the Older Americans Act funding, like the Congregate Nutrition Program. The goal is to serve those at highest economical and social risk, and that is a priority audience for extension and outreach as well. Iowa State Extension and Outreach as well, and so we provide those programs through supplemented costs. So they're free to the agency, and we support those in other ways. So we don't make them pay for the programs that we're offering.
Yeah, I'd say that's a good example of braiding funding because prior state nutrition education, AAAs might have been hiring a dietitian to write their own nutrition education. Now they're paying for the printing costs and everything, but to braid those funding sources together to get the creation of the documents from somewhere else is a good example of partnership.
You can also raise your hand or unmute yourself and ask your question out loud if you have any. All right. Alex, I think we can stop sharing, and then I think Shelley has some wrap up for our audience, our participants.
I do. I'm trying to share my screen here and get that QR code for you. I think it's sharing. Can everyone see that?
You need to do presenter mode.
Yeah.
Make sure to click from current slide. There we go.
All right, there we go. Can everyone see? We just would like to ask again for you to fill out our survey evaluation to help us create good, interesting webinars for you. We really appreciate that feedback. So I think that wraps up today, and thank you for attending.